Physical Therapy with Bamrungrad International Hospital. Episode: Cardiac Rehabilitation Before and After Cardiac Surgery During Admission. After cardiac surgery, cardiac rehabilitation is necessary to help the patient's recovery as fast as they can, prevent post-surgery complications caused from long-term lying down in bed, and safely regain their daily activities by encouraging the patient to move their body correctly. This cardiac rehabilitation program has been recommended in the guidelines of the world-class health institutes, as it is beneficial and quite necessary for the patients who are suffering from heart diseases, post-myocardial infarction, and heart failure, including those who underwent heart surgery. At Bamrungrad International Hospital, we have a multidisciplinary cardiac rehabilitation team, including physiatrists, physical therapists, nurses, nutritionists, and pharmacists, who can carry out tailor-made cardiac rehabilitation programs for each post-operative cardiac patient. This program includes proper exercise with continuous EKG monitoring and individual advice on lifestyle change for better health, better ability to do daily activities, and faster, safer, and more efficient recovery to reduce the risk factors of recurrent heart diseases. Our goals are to make the patients have confidence in daily living and optimal home exercise on their own. Most common post-operative complications involve respiratory and circulation systems. Pre- and post-operative cardiac rehabilitation can help prevent these complications. Please be introduced to pre- and post-operative rehabilitation to prevent possible post-operative complications. Lung atelectasis. Is the condition that air is not able to pass through lung space due to the collapse of some part of the lung. Incorrect or shallow breathing can aggravate this condition. Correct breathing can be done as follows. Breathing by using diaphragm and abdomen. Place both hands, palms down, on your abdomen, below your sternum. Inhale slowly through your nose, expanding your stomach. Then exhale slowly through your mouth, deflating your stomach. Breathing by using the muscles in the upper ribs. Place both hands, palms down, under your collarbone. Inhale slowly through your nose, causing your chest to rise. Exhale slowly through your mouth, lowering your chest down to its normal position. Breathing by using the muscles in the lower ribs. Place both hands, palms down, on your ribs. Inhale slowly and deeply through your nose until you feel your ribs expanding to the sides. Exhale slowly and deeply through your mouth until your ribs are back in their normal position. Breathing combined with movement of the chest and body is to create flexibility of muscles around the chest, shoulders, and body, which will make breathing easier. There are two types of this breathing as follows. Type 1. Sit up straight. Raise both arms while inhaling deeply. Exhale slowly through your mouth while gradually lowering your arms. Type 2. Sit up straight. Open your arms to your sides while inhaling deeply. Exhale slowly through your mouth while gradually closing your arms. In addition, we also use the tri-flow to help breathing exercise as follows. Place the mouthpiece in your mouth, exhaling fully through your mouth. Inhaling through your mouth so the balls in the tri-flow rise and hold your breath as long as possible, or for 3 to 4 seconds. Repeat 5 to 10 times each hour. Lung infection is aggravated by general anesthesia during the surgery, causing temporary stopping of the cough center and the system that expels phlegm. The phlegm causes airway obstruction. We can prevent this complication by teaching the patients to correctly expel the phlegm as follows. Ask the patient to hold a small pillow against the chest at the incision area. Inhale through the nose until abdomen expands. Exhale slowly through the mouth. Repeat inhalation and exhalation as mentioned for 2 to 3 times. Ask the patient to cough twice to expel the phlegm. After expelling phlegm, normal breathing should be done. Repeat the process one more time to ensure the patient expels the phlegm correctly. In case the phlegm is very sticky and difficult to expel, the therapist will help tapping or vibrating the lungs. Complications of the circulatory system. Patients who undergo heart surgery are at risk of deep vein thrombosis, or DVT. We can prevent this complication by helping patients exercise arms and legs as soon as they regain consciousness after surgery. Lift the head of the bed to place the patient in a sitting position. Start with making their hands into the fists. Slowly open their hands. Repeat this exercise 5 to 10 times. Slowly stretch out and straighten their arms to the front. Slowly bend their elbows until their arms are against their body. Repeat this exercise 5 to 10 times. While sitting upright, push both arms out gently in a punching motion. Alternate arm back and forth slowly. Repeat this exercise 5 to 10 times. Let's move to the lower part of the body. Ask the patients to move their feet up and down for 5 to 10 times. Ask the patients to stretch out and straighten their legs to the front for 5 to 10 times. Slide the heel toward the buttock, then straight out for 5 to 10 times. Besides the advice on pre- and post-cardiac rehabilitation, the patients will receive appropriate nursing advice for pre-operative situation and possible equipment attached to proper post-operative behavior of the patients. After heart surgery, the patients have to stay in cardiac care unit or CCU for 1 to 3 days for close observation until their condition is stable, and then the patients will be transferred to regular ward for continuous post-operative care and cardiac rehabilitation. Cardiac rehabilitation is specifically programmed and will be quickly or gradually completed depending on the patient's condition and compliance. The first step, the patient still has a drainage tube from the chest area, a cable around the neck to monitor the pressure in the heart chambers, an intravenous fluid line, and a urinary catheter. In-bed cardiac rehabilitation will begin with breathing practice by TriFlow, effective cough to expel phlegm, exercise of hands, arms, legs, knees, and feet, and practice on sitting up in bed. The second step, it will start after all wires and tubes from the first step are removed. The patient can sit, stand, and take a short walk within the room or around the nurse station under supervision of the physical therapist. During this period, vital signs will be monitored. The third step, clinical nurse coordinator will provide necessary knowledge for the patients for controlling, reducing, and preventing the risk factors of recurrent disease. The fourth step, after the patient can walk stably and safely, physical therapists should encourage the patient to continuously walk for longer periods of 10 to 15 minutes. The fifth step, after the patient can walk safely on the flat surface, physical therapists should encourage the patient to walk up and down one flight of stairs. The final step, after passing all 5 steps as mentioned, the patient will have the advice for more exercise by riding stationary bike or walking on the treadmill, starting with a short period of time under close supervision of cardiac rehabilitation team. EKG monitoring to monitor vital signs will be done for the entire exercise process. Before being discharged from the hospital, the patient will receive individualized advice from the multidisciplinary team as follows. The nurse will advise the patient on wound care, possible complications, and abnormal signs that the patient needs to come back to meet their doctor immediately. The nutritionist will advise on most nutritious and appropriate foods to consume and ones to be avoided. The pharmacist will advise on the significance, indicators, and points of caution of each home medicine. And physical therapist will advise the patient on a proper home exercise program and the concerns of stopping exercise because their lifestyle and behavior will be changed and ensure that the patient can do it correctly and safely. After discharge, the patient is encouraged to regularly participate in an outpatient cardiac rehabilitation program at the hospital, aiming for quick, safe, and efficient recovery of full physical strength. If you have any questions, please contact the Cardiac Rehabilitation Team at the Inpatient Physical Therapy Department of Bamrungrad International Hospital at telephone number 02-667-2415.